Hello, my name is Bill Vaughan with VICAP, the Virginia Insurance Counseling and Assistance Program. And what we're going to do today, in less than an hour, is walk through a series of slides. We're going to emphasize some points on them. And at the end of the hour, you're going to know a lot about Medicare. I think you're going to be able to save some money and get better quality health care and basically just be comfortable with Medicare. That's our goal today. And a couple things, it's not that hard. If you have figured out how to get to this site, you can figure out Medicare, promise you. And two, congratulations for being here. We have people who call us and say, I turned 65 a couple years ago, was I supposed to do something? Those people have probably missed the boat, so congratulations for being here. And a couple points. We're going to kind of romp. It'll be a fast hour. And if you have questions, if you get confused or lost, call us and we will walk it through with you one-on-one until you're comfortable with the presentation, okay? So if I lose you, don't despair, hang in there and we'll work it out. The other one is we're in this obviously pandemic period and Medicare has loosened a couple rules, and God forbid anybody gets sick, but if you get sick and have some huge Medicare expenses because of COVID, there's maybe some special relief for you. Keep that in mind, that this is a special time. And it's also a special time because it's brought out some incredible low-life crooks. If you're smart enough to be coming to this presentation, I know you're smart enough not to be giving out your Social Security number or your Medicare number over the phone to some idiot trying to sell you COVID cures. But be careful. There's a lot of scamming going on there right now. So let's get started. Who is VICAP, or what is VICAP? Tiny little office in your county government. Has a couple staffers and most of us are volunteers. And our goal is to provide free, independent, no conflict of interest, objective advice on your choices in Medicare. I promise you I've never taken any money from, and I never will, anybody who's trying to sell you a product in Medicare. And that's important. Be careful. We see a lot of ads that are frankly wrong, maybe lies. Almost all the companies trying to sell you stuff in Medicare are for profit. Caveat emptor, be careful or be questioning the endorsements that you see. Some companies pay hundreds of millions of dollars for the use of somebody's name, for their endorsement. Be suspicious. This is our contact, the staffers who can help you on difficult Medicare problems, and probably the best source of information is the Medicare.gov website. I can use it without my techie kid helping me, okay? It's very good. If you got a question, you can type in the question. And the Medicare second website, cms.gov, boy, that gives you more than you probably want to know. Both websites really excellent. What is Medicare? Well, you've tuned in, you have a basic idea. It's surprising 1 in 6 people on Medicare are young folks, people who are injured or disabled in life and may have been on Medicare 30, 40 years. What's different between Medicare and what you've had the rest of your life is it's you and Medicare. You have a Medicare number, you pay a Medicare premium. If you have a spouse, he or she pays different premium, separate premium, has their own number. There's no group policy. There's no family policy. It's Medicare and you. And we're not going to get today into the details of the different benefits. I mean, there's like 4 different colorectal anti-cancer screening benefits. Really yucky to talk about. We're not going to do that. We're going to talk about the key things, the key decisions that you need to make. And the first one is, well, pause a moment. Think about Robert Frost's great poem, 2 roads diverged in a wood, and I took one, and it made all the difference. Medicare has 2 roads. One is the fee-for-service You get a service from your doctor, Medicare pays him a fee. Fee-for-service, original, traditional Medicare. And the other is something called Medicare Advantage or Part C, it's managed care. Companies like Kaiser and Humana and Aetna and United ARP, they provide the hospital and doctor and drug services, in most cases, that you need. And you can go fee-for-service, traditional, original Medicare, where you pick your doctor and get as much service as you want, or you pick one of these companies and they help manage your care and give you the Medicare package. That is a threshold question that we're going to spend really most of the hour on as to the pros and cons of this key choice. Second, should you get Part B that relates to doctors? And if so, when? Third, should you get a drug plan, Part D for drugs? And if so, how do you save money and get the best deal there? And then last, if you choose traditional, original, fee-for-service Medicare, do you want to get one of those MEDIGAP or Medicare supplement? Same thing, MEDIGAP, supplement, same term. Do you want to get one of those plans, and how can you do it and save a ton of money? And we've got some good advice there. So these are the key choices we're going to be talking about. And the good news is if you make a bad choice, if you're not happy with that drug plan you picked, every fall in the open enrollment season between October 15th and December 7th, you can change. No questions asked. They can't reject you. You can change. So if you joined a turkey of a plan, you can change that Part D drug plan. You can change that managed care Part C plan. You can change from original Medicare to one of these managed care plans. So that gets a little sticky, and we'll talk about that. What you can't change is these MEDIGAP or Medicare supplement plans. Think of them as a lifetime commitment, because once you've had one for a year, they don't have to sell you their product again at a fair or reasonable price. So MEDIGAP, don't count on changing. These others you can change. The bad news is you need to make some of these changes in a timely manner, and you need to review each fall. You need to get 5 minutes on the calendar that I'm going to review my Part D or my Part C managed care plan to make sure that what I thought was a good deal in 2020 is still a good deal in 2021. Okay, there's 29 Part D drug plans selling in our county and about 24 Part C plans, with a couple of exceptions, Kaiser basically. They're all for profit. And I'll guarantee you guys, if they're losing money in Fairfax County in 2020, they will change what they sell you in 2021 to make money. That's their goal. That's their job for their stockholders, is to make money. They're not charities. And they will change on you. And you need to just spend 5 minutes on the computer, the Medicare.gov website, and make sure that the good plan that you had that covered all the drugs you needed is still going to do that in the new year. You can lose thousands and thousands of dollars in the new year by not paying attention to changes in these plans. It's not fun, but it's only 5 minutes on the website, can save you hundreds and hundreds, thousands of dollars, okay? You should know the basic lingo of Medicare. There's 4 parts. Part A, hospital. Part B is mostly doctor stuff. Part C are these managed care Medicare Advantage plans like Kaiser and Humana. Part D, that's the only easy one, isn't it? Part D, D equals drugs. That's the 4th part. And the program's having its 55th birthday in a couple weeks. It has evolved over time. Part D came along about 15 years ago. Part C has been taken off in the last decade. You hear about it more and more. It's just a program that has evolved. And sorry, suck it up and try to know those terms because you will run into them a lot, okay? And to repeat, your doctor's office will want to know what type of Medicare you're in. They will say, hey, are you an original fee-for-service Medicare? And that means you are not in one of these Part C Medicare Advantage managed care plans. So know which road you have picked to go down because your doctor's office will sure want to know, okay? Let's dig in a little bit. Part A is mostly the hospital stuff. I've got it here in a little box. It's hospital type stuff. You get it at age 65 and it's free, right? I wish you all were here because at that point, at least a lot of you start to giggle and laugh because we've all reached the age we know there's nothing free in life, right? It is not free. All your working years, a little bit of your Social Security tax was sent over and put in a Part A trust fund so that when you turn 65, you have earned this and you get it at 65 and it will feel free. You owe nothing more if you have worked 10 years, 40 quarters. Pretty good benefit, except wow, look at that. First day deductible. First day I go in the hospital, I owe the average cost of a hospital stay in America, $1,408. And it works, it's a little weird, it works on a 60-day admission cycle. Let me see if I can explain that. Take a look at this slide. I have a heart attack this afternoon. I go in, I'll pay $1,408 deductible. The next day, free. Day after, free. If I have surgery, I'll pay the surgeons under Part B, but I won't pay for hospital services. And I'm lucky. I get to go home on the fourth day, and if I'm out of the system, if I don't go in the hospital or a skilled nursing facility for 60 days, the cycle starts over. So if I have a recurrent heart attack, on what's really the 65th day, I would owe another deductible. So all you folks at home, plan your heart attacks for around day 30, and you won't have that another deductible, right? Well, obviously we can't do that. And you can see if you were having a very bad year, you could have a deductible, another deductible, another deductible. Those deductibles, which can be big, are why people want to buy MEDIGAP or Medicare supplement policies to fill the financial gaps in Part A and B of Medicare if they don't have a good company retirement plan. So if you don't have a good retirement plan, like federal workers, you probably will want to buy something to fill in these gaps, okay? We're going to talk about that a lot more. Part B is doctor type stuff. This is voluntary, it's optional, you don't have to get it. It covers everything from lab tests to wheelchairs to home health visits. As I say, optional. And you pay a monthly premium for it. For most of us this year, it's $144.60. So wow, that's a lot of money. Nah. It is a bargain. The 144 is one-fourth the cost of this insurance product. If you tried to buy it on the street, the real cost would be about $560 a month. And our kids, the Treasury, the taxpayers are paying 3/4 of it for most of us. We're paying 1/4. And I know that can be expensive, but healthcare in America is expensive. And basically it covers 80% or even more of a whole range of things. And you hear seniors getting together over coffee or something, oh, doctors aren't taking Medicare patients. Yeah, they are. There's real shortages. There's shortages in family docs, internist types. If your doctor looks like she or he might be retiring soon, you might want to start shopping, because it takes a while to find a family doc who's taking new patients. Same in psychiatry. Very hard to find doctors who are taking insurance. Dermatology can be a problem. But in general, our problems as seniors is no worse than it is for 60-year-olds, people pre-Medicare. There's a little government agency that does a poll each year of 4,000 people on Medicare and 4,000 people age 50 to 64. And by almost every indicator, the Medicare people are happier, easier to find a doctor, easier to pay their bills, less waiting time. They're there. The issue is, this is your assignment. Check and look for those who take assignment. Find doctors who take assignment. About 90% of the nation's doctors are taking Medicare. 98% of the 90% take assignment. And that means, it's a legal term, that means they accept as payment in full the Medicare fee schedule. So let's say you go to your doctor for something that Medicare said, the amount of energy and materials and bandages and stuff for that is worth about $100. So Medicare will pay $80 and you'll pay $20 on that fee schedule. If the doctor is one of those few who does not accept assignment, a non-participating doctor, they could charge you 15% more, roughly. We've simplified a little here, but you'd owe $35 instead of $20 in this example. Pretty rinky-dink example. What if it were brain surgery? 15% of brain surgery could be big bucks. So try to find the ones who've taken assignment. By the way, the term opted out means they're one of the 10% docs who are just saying, no thank you, I don't want anything to do with this. And if you go to them, you owe everything. They don't have anything to do with Medicare, and Medicare won't help you with them, okay? Those are the doctors who have opted out. Part D stands for drugs. Again, voluntary. It's very optional, but it's a good deal for most of us, and most of us are getting some kind of drug coverage. The benefits started off pretty weak. You've probably heard of a term donut hole, where for thousands of dollars of drug costs, you had no insurance. That's gone away, phased out. In 2020, we finally have a really pretty good benefit where in the 29 plans in Fairfax County, they'll all vary a little bit. Some of the differences are mind-numbingly small, but they'll all have little variations. And in general, you may have no deductible, or you could have a plan with a deductible of as much as almost $500. Then you'll owe 25% of the cost of roughly the next $9,000 in prescription drugs. And then you've reached what's called catastrophic protection, where the plan will cover all but 5%. You will owe 5% of your remaining drug expenses ad infinitum. Well, that ad infinitum has become a problem. The new drugs coming on the market for anti-cancers or MS, insanely, breathtakingly expensive. They may be miracle drugs, but they're incredibly expensive. I had a call one day from a person who, to live, had received prescriptions costing $840,000. What is 5% of $840,000? A lot of money, right? 40 plus thou. This is, in my opinion, the Part D benefit is eroding in value because the new drugs are so expensive. The House of Representatives has passed a bill that puts a hard cap on how much we seniors would have to pay at a couple thousand level. The Senate is thinking about it. One of these days, I think there will be a serious debate on this issue, and you can see why when when you have people in Fairfax County being prescribed $800,000 plus worth of drugs. Pay attention to that debate, please. Part C. Part C, also known as Medicare Advantage. Just a minute on that. That's a name that was legislated about 20 years ago now, almost. People in Congress wanted more of us to join these things, and the previous name was pretty boring, and so they said, let's call them Medicare Advantage. And they may be an advantage for you. I have a friend who had a bad experience with them, and he calls them Medicare Disadvantage. That's a little harsh, but do realize that the term Medicare Advantage is a propaganda word. These are just the plain old vanilla managed care plans that you had in your working years. And what happens is, let me put this here so you can see it, they contract with a network of hospitals in the county. Maybe in traditional Medicare, all hospitals participate. The companies like, again, Aetna, Kaiser, they may contract with, on average about half the hospitals in the county. And instead of 90% of the doctors, they contract with about half. And if you go outside that network, you'll probably pay more, or you may pay everything. And most of these plans offer a drug benefit that operates very much like the Part D benefit in traditional Medicare. What you have to do is pay your Part B premiums if you want to join one of these things. But as you can see from me putting these parts in this box, Part C is your way of getting your A plus your B plus your D all through one company like Aetna or Humana or Kaiser. I hope that's clear to everybody. You need to pay your Part B premiums. What's interesting is you cannot legally buy a MEDIGAP policy, or you can't be legally sold one. What's cool, and you're seeing this in lots and lots of advertisements, is you'll probably get extra benefits, that things that Medicare doesn't cover, like eyeglasses or hearing aids or dental. We all know dentistry is expensive, and some of these plans are covering some dental services. But the key thing here, the key difference from original Medicare is you go to a network of hospitals and doctors. I want to spend a minute or two on this extra stuff because in the last year, the administration has allowed these companies to offer more and different kinds of extra free benefits. And I've seen some ads for these that are not truthful. Be very, very careful and probe very hard on what those extra benefits are and whether you qualify for them if you join that plan. In my opinion, there's a lot of exaggeration going on about this, and it's important to understand what's happening. Let's spend a minute on, and this is simplified, but how are these plans paid? And that'll tell you everything. Medicare determines the average cost of fee-for-service care in a county, and believe it or not, it's about $10,000 per person per year to keep us guys alive at our age. And the law says that these companies have to then submit a bid if they're going to serve us in the county. And if the bid comes in high, above the average cost, say $11,000, you'd pay more in a premium. Makes sense. If the bid comes in below average, say $9,000, well, the company makes some money and stuff, and as I say, this is simplified, but you get a bunch of that money back in extra benefits or lower premiums, which is cool. But you might say, whoa, how does this plan come in below an average cost? Where does that come from? How does that happen? And there are good ways for that to happen and bad ways. Good savings would be HMO, Health Maintenance Organization. Keep Bill healthy. Make sure he's got his flu shot and his pneumonia shots and his shingle shots, and keep him out of the hospital, and the company will make money keeping me out of the hospital. That's good. That's what I want. Maybe they negotiate a better deal with Innova. They'll say, hey, we'll bring you 50,000 customers. Give us a discount. Those are good savings. And then there are companies that have bad savings. They avoid sick people. Or if you get sick, they make it very hard for you to get care. Oh yeah, we got a chemotherapy doctor at the other end of the county. Or they make you wait for knee or hip surgery, or they deny appeals and hassle you. Bad savings. Sure, you get some extra stuff, but you have a real hassle when you get physically sick. So, we've all reached the age, we know there's no such thing as free extra stuff. And these extra benefits are not free, they are part of a trade-off. And there's good trade-offs, or there's bad. And our job as consumers is to pick the good one, and that is not easy. The place to start would be the Medicare website will give star ratings. 5 stars is tops, and in our opinion, 3.5 stars or lower is pretty poor, and you probably want to avoid those guys because some of their savings will be questionable in our opinion. Complicated, but it's worth spending the time because that's where all these ads are focusing on, okay? MEDIGAP, or Medicare Supplement. Ta-da! MEDIGAP or Medicare Supplement. This is not a box, as you can see. This is not a cardboard box. This is a red rubber ball. And we made it very different to show that MEDIGAP, Medicare Supplement plans, are very different. They're really not part of Medicare. They're not part of the federal government. The feds have a bunch of rules governing how you can buy and sell the things, but these are regulated at the state level by the Virginia Bureau of Insurance, and they're really not part of Medicare. They cost, a good comprehensive one would be $100, $120 a month at age 65. They will go up as you age. If you buy one at 65, life expectancy, expect to pay almost triple by the time that you die. Just budget for it. And this is going to be a great place to save money by shopping carefully, that we're going to get into. And I would stress again, when you buy one of these things, it's kind of a lifetime commitment. There's no open enrollment season where you can change these policies, okay? We've had people who wanted to buy a MEDIGAP policy, called a company, and were sold into a Medicare Advantage plan, which when they went to their doctor was a shock because the doctor said, hey, I'm not in that network. Why'd you join that plan? You have to pay me everything yourself. So know what you're buying. My father used to tell me that chicken poop and chicken soup come from the same animal, but there's a world of difference in the taste. World of difference here, guys. Pay attention. Lower income people, if your income's below these levels, and that's about 1/4 of us in Fairfax County, you can get some help paying your premiums, your Part D drug costs, and the lower your income, the more the help. We think there's about 14,000 people in our county who haven't signed up for these programs of assistance and are having a much tougher life because of it. If you ever hear somebody say, I can't fill my prescription, I can't go to my doctor because I just can't do that copay, have them call us or have them call the state Medicaid office, Medicaid, AID on the end, And there may be help that would make life a lot better. I hope all you watching are making tons of money and fall into this category, but only 7% of us do. If your income's above those levels, you're asked to pay more than 25% of the Part B premium. How much more? This is the current schedule. Most of us are in this category here where we pay 25% and our income as a couple is below 174. But if you were lucky enough to have earned $750,000, you'd pay 85% of the cost. You'd still get a 15% subsidy. The confusion here, 2018 income. It takes a couple years for the IRS to get to Social Security and Medicare and say, hey, Bill should pay more. So there's a 2-year lag. Your 2020 premiums are based on your 2018 income. Whoa. 2019, I lost my job, I retired, my spouse died, we got divorced. My life situation changed dramatically. I still have to pay that? No. You can file a form with Social Security and say, I've had a life-altering event. I'm really not living on the kind of money you think I am. Please adjust the Part B premium. That does not apply for a sale of an asset. If you cash out of the stock market or sell a house for a big profit, that is not a life-altering event. But retiring is, and you can get your Part B premiums adjusted. Lots of things Medicare doesn't cover, and I'm afraid the big one is just us getting old and having trouble getting out of bed. Kind of the need for somebody to help us on a daily basis. And dementia. It does a lousy job of helping families with the cost of treating an Alzheimer's patient. This is from a New York Times story of about 5 years ago now, rounded the numbers. But what it is the Times looked at 3 families where a person was dying over a 5-year period of all their expenses over 5 years for death from cancer, heart disease, Alzheimer's. And as you can see, the Alzheimer family has a heavy load to carry. And I think this cost is low in our county. To have a full-time care at a place like Arden Center is, I'm told, above $60,000 a year. So it's very tough. So, plan for medical expenses. And we've been spending money like drunken sailors this spring, haven't we? And at some point, we've got to deal with it. And there will be pressure for more budget cuts. And you just need to plan on medical expenses, folks. I'm sorry this isn't a happier talk, but I think it's a realistic one. Review, thrown a lot at you, real quick. A, think about it, hospitals. B, mostly doctors, optional. C, the way to get A plus B plus D, but never a MEDIGAP policy. D is drugs. MEDIGAP, Medicare supplement policies do what? They fill in the financial gaps in Part A and B, but not D, not the drug part. Lower income can get help, higher income have asked to pay more, and there's a lot Medicare doesn't cover. Deep breath, on to our choices, okay? And again, if I've lost anybody or you want to talk this through more slowly, give us a ring and we're happy to try to help. At whatever age you start Medicare, you have this key choice. Again, Robert Frost, 2 roads in a woods. You can go fee-for-service, you can go Medicare Advantage. If you go fee-for-service and you don't have a good company retirement plan, like feds do, you probably want to enroll in Part B. You've earned a Part A, remember? Feels free. If you don't have good drug coverage, get Part D. If you don't have retiree coverage, you probably would want to buy one of these guys. Remember that $1,408 hospital deductible. You'd want to have that covered. Or you go with Humana and managed care. And most of them cover Part D, so you don't need to do a separate Part D plan. You have to enroll in A and B, and you cannot buy a MEDIGAP policy. Those are the two roads. And each year, open enrollment season, you could switch back and forth. You could say, hey, I want to go try one of these managed care plans and all that extra stuff they're promising to me. Be careful. Be careful. Let's just read this aloud. With a few exceptions, you probably will not be able to easily switch MEDIGAP plans after you first choose one. And once you don't have one, it may be impossible or difficult to repurchase one at an affordable price. And that makes the real switching back and forth very difficult. It's a bit sticky. You can you can change your Part D drug plans, you can change among the different C plans, but the moving back and forth, because of that MEDIGAP problem, can be a real hassle, folks. This chart just says it a little bit cleaner. I think if you have a good feel for these choices, you have really a handle on the heart of the Medicare issues before you. But this is a simplified version of the previous chart. And so, folks, which road is the one that you should go down? What's the best choice? There's no answer to that. That will depend on you and your health, your psychology, your skill in managing, standing up for yourself. You can say a few things very clearly, that if you look at the total amount of money you need to spend on the first of the month in premiums going out the door, checks going out of your banking account, managed care is cheaper. Why? Because you're not spending any money on this. You can't. So there's $120 that you're saving. Whether you'll save money when you get older and sicker, no idea. This may be more expensive when you're fighting cancer. We don't know. Almost all of them allow you to get this extra stuff, gym memberships even. And that's good. That's good, but remember, it's not free. It's a trade-off for other things that they don't do. And just keep that in mind. The cons, it comes down to really one big thing in my book, is they're skimping on care. There's a lot of academic research that shows that as we get older, upper 80s, frail, need more rehab, want a fancier wheelchair, maybe need more and more complex medicines, we get unhappy and try to leave managed care. And because of that MEDIGAP thing, I mean, at that point, when you're old and frail and sick, MEDIGAP company isn't going to be selling you. You know, they don't make money selling us when we're old and sick. They won't sell you that policy, and then you're in trouble. So in an ideal world, you look at your family history and your gene pool and you say, hey, I'm going to die at 100 in my sleep and healthy. Join managed care. You'll get extra stuff. You'll save money. If your family gene pool looks a little shaky and relatives have had long, torturous deaths, you might want fee-for-service, where you'll have more options and more ability to get some extra testing. There is no simple, easy answer, but these are some of the pros and cons to think about. There's more cons there. And again, on our website, we have materials that help elaborate on some of this. If you choose the managed care route, some recommendations. Pick one that covers drugs. Not all of them do. If you have a doctor or a specialist you really care about, check that that person is in the network. The computers and the websites may say the doctor is. Terrible level of inaccuracy there. Call your doctor. Just pick up the phone and say, hey doc, if I join Humana, will you still see me in the morning? And double check. Go with the higher quality stars, in our opinion, and probe on what the extra benefits are. You say free dental. Well, how much? Is that cleanings or is that crowns? World of difference. Probe on that. Part B issues. If you pick managed care, you got to join Part B. If you do the traditional fee for service, you don't have to. But if you're on the far left, if you're retired and you don't have doctor coverage, for gosh sakes, get it. It's a bargain for most of us. As I say, we're paying about a fourth of the value of the product. You get it around your birthday. If you don't, you could face a late enrollment penalty. Pretty stiff one that grows year by year. Can really hurt. In the middle column, there's a lot of us in this boat where, okay, I'm still working. I'm working at age 70. I'm working at age 80. And I'm happy with my company plan. Do I need to join Part B and pay these premiums and $144 on top of what I'm paying my boss? No, you don't have to. But once you finally retire and no longer have health insurance from active work, join Part B within 8 months, 2 months for drug coverage, and you won't have a late enrollment penalty. And then this side, a lot of you do have good company coverage. And the question is, I'm probably paying the boss something. Do I need to join Part B? And that'll depend on the details of the finances. We've had people call us who are paying their boss at age 70 like $1,200 a month for health insurance. And wait a minute, I could get Part B for $150, call it, a drug plan for $30, and a MEDIGAP for $120. That's $300, and I'm paying my boss $1,200. Some company plans are white elephants, and you might think about whether you really need them and whether it wouldn't be better to drop the company plan and go with Part B. Others, it's a very close call. Federal workers have this huge debate. Should they join Part B? And I commend to you something called, you federal workers, Washington Consumer Checkbook, Guide to Health Plans, 2020 edition, for federal employees. Saved my wife and I a ton of money, and it is updated each year and gives you the pros and cons of whether you should join Part B. It's worth a read. But on this, if you have a good company retirement plan, there is no easy answer to the question of whether you should or should not get Part B. But it's a chance, a place where you could make some savings. If you're in a small company, you probably have to join Part B. If you have health savings accounts, for gosh sakes, quit contributing to them before you start Medicare. Call us if you have COBRA. There's a couple tricky things about COBRA that you need to know about. There are some complicated areas, and maybe you mishear me today, so double check in writing or call us to reconfirm, okay? Drug coverage. Future of healthcare in America seems to be drugs, these miracle drugs, and you need insurance for them. If you do not have creditable, that's a legal term, creditable coverage from your union or workplace, then you should get a Medicare Part D drug plan. And creditable means the value of the plan you have in the workplace is as good as or better than the Medicare standard drug package. And you get it when you're turning 65, or if you don't get it in time, there's a small, but each month it goes up, late enrollment penalty. No sense paying that. Well, we get people some of you on the audience might be saying, well, gee, I just go to Walmart and I got a $5 generic, and why should I join one of these plans? So if you take few or cheap generics, join a low premium plan. Of the 29 in our county, 2 are for sale for about the mid-teens, a little under $15 a month. And by joining, you prevent the late enrollment penalty from starting, and if something happens, you've got catastrophic coverage. I mean, you might have the silent killer, hepatitis C, the course of treatment, $60,000 to $80,000 worth of drugs in a couple months. By joining a plan, you would have coverage. You can always change in the open enrollment season once you start taking a bunch of pills for a plan that's better for you. If you take lots of pills, go to the Medicare.gov website, put in your zip code, find a drug plan, put in the drugs you know that you'll be taking, the high blood pressure or the diabetic drugs. And the 29 companies will rank from lowest total cost to highest. And high can be really high, guys. This is a great place to save money. And I said, you're looking at total cost. We have people call and say, hey, what's the plan with the lowest premium? That'd be like buying a car on the basis of the lowest cost tires. No. You're looking at premium and deductible and the cost of the drugs. And the website will give that to you. And then we recommend going for higher quality stars among the 3 or 4 plans that you want to get detailed information on. And what I said earlier, shop each year. There's studies out that show that the average senior could save about $400 a year. Not the average senior, 85% of us could save about $400 a year if we shopped for the best plan. And people just fail to do that. And it's like leaving money on the table. So the Medicare.gov website is the place to go to get a good price for on a Part D plan. MEDIGAP. Back to MEDIGAP. Again, the rubber ball, they're different. They're not like the rest of Medicare. If you're in managed care, you can't buy one of these things. If you're in traditional fee-for-service, you have to have Part B. And if you don't, as I say, if you don't have a good retirement plan, you probably want to get one. And what is one? This is hard to read, but what it is about 30 years ago, there was so much fraud and abuse in this sector that Congress said, hey, all you guys selling MEDIGAP, you got to standardize your product so that people can shop on the basis of price and not just ticky little differences among the different plans. And so they set up, there's a Plan A, and it'll cover the 4 checkmark things. Most Virginians, we think, are going with Plan G. It's the most comprehensive. It'll cover everything where there's a check. All Gs sold by all the different companies in Virginia, almost 30 companies, all Gs are identical. Nobody sells a G that doesn't cover all those things. Nobody sells a G that adds anything else. So for gosh sakes, they're just bill payers. They have nothing to do with your health. If Medicare will pay the doctor 80%, these companies automatically follow along and pay the 20%. So for gosh sakes, we think go with the low-cost one. And how you do that? Real easy. By the way, you're getting a lot of mail, buying different things and stuff. All this mail, this is like a week my wife and I got this. Throw it all away. Get rid of it. Get rid of it. What you do is you go to our Bureau of Insurance website, and they'll give you this chart with the names of the companies down the side, the model plans across the top, and the costs. The cost. Just run your thumb down the cost column, find one of the cheaper ones, call them up, and enroll. The key, the secret, the absolute key is after you're 65, you could be 90, But after you're 65, and in the first 6 months that you have enrolled in Part B, all of these 30 companies have to sell you all those different models, no questions about your health history. 6 months in a day, they can ask about whether you had pneumonia in elementary school, or they'll say, gee, Bill, you've had skin cancer. You've had things taken off. We're not going to cover skins, and maybe we won't cover cancer. You have a proclivity, or we're going to charge you more. Or we're just going to say, go away, Bill. We don't want your business because you have been sick. So you've got a 6-month window where they can't do that to you. And outside of that window, good luck. We're almost done. This is a chart that just shows the point that if you're worried about the amount of money you spend on the first of the month, managed care is probably cheaper. We don't know if it'll be cheaper when you get sick, but at the first of the month, it's cheaper because you're not buying a MEDIGAP policy, right? We have a chart that summarizes key points that we've been talking about today. I know that's hard to read and small, but as I say, you got questions, call us and we'll walk them through with you again, okay? Applying for Medicare, if you're getting Social Security at 65, they'll send you an A and B card, Medicare card, and you can decline the B. You say, no thanks, I'm still happy working. But if you're not drawing Social Security and you want Medicare, you should apply. And you can apply around your birth date, 3 months before, during, 3 months after. There's something called a general enrollment period, which is January 1 through March 31st, coverage starting July 1st. These are important dates, people. One of the saddest calls I ever got was a person called me on April 6th, April 6th, I remember it, and said, I have just come from the doctor and he says I have to have a major surgery, life-saving surgery immediately. How soon can I get Part B coverage? Not July 1st of this year. The answer was 15 months later. The person would have to apply January 1st for coverage of July 1st the coming year. These are important dates. You hear friends and neighbors talking about, I'll get to it. Pay attention. And again, we talked about if you're working and you've got company coverage and you're happy, you have a period to sign up anytime while you're still working or within 8 months of when you finally quit. And you do have to document to Social Security that you have been covered. So it's just a little bit of paperwork, but not too bad. Last points, $3.6 trillion American healthcare system's got a lot of fraud in it. Help us fight it. In Medicare, you will get a statement every 3 months of all the bills paid under your Medicare number. And if you see something wrong, call the billing department and say, hey, I think that was a chest x-ray, that wasn't an MRI. And people make mistakes. But if they resist, report it. That's why our premiums are so high and why our kids' taxes are so high, is there's a lot of fraud in this, and we need to help fight it. And I'd make one other last point, something called observation status. About 10% of us, when we go into the hospital, run into this problem. I talked about having a heart attack and the first day deductible. Well, maybe it was spicy food I had for lunch. And the doctors say, yeah, we're not going to admit you for a heart attack. We're going to observe you. We're going to put you in the hospital bed overnight and feed you our food and give you those beautiful gowns with the opening in the back. And we're going to observe you. In general, There's no hard rule on this, but we would recommend that if a spouse is helping you or a family doctor or something, agitate, tell them they'll make you happy if they would admit you rather than just observe you. If you are admitted, you pay that big deductible, but if you're in observation status, you pay under Part B, 20% of everything they do for you, and boy, oh boy, does that mount up. More importantly, you don't start the clock running on 3 days in a hospital. That 3-day requirement to get the 100 days of skilled nursing facility isn't triggered. And we've had people who thought they were admitted and went to a skilled nursing facility, and after a couple weeks, when the nursing home realized that they had only been observation status, they came and said, you owe us $30,000 because Medicare doesn't cover this because you were in observation status, not admitted. This got so bad that 2 years ago, Congress and the Virginia Assembly passed a law that after 36 hours, they've got to come to you, and if you're awake, talk to you, or leave you a piece of paper if you're sleeping, telling you your status. And again, in general, we would urge that you probably want to agitate to be admitted, but that is up to the hospital. And last, pay attention. There's going to be big congressional budget debates and debates on the cost of drugs, and the Medicare program is a public program and subject to change, so pay attention. And thank you all for tuning in today.